Thank you for looking to the future as leaders with National Center for Healthcare Leadership, and for what you're going to do as leaders to create a healthy culture. The objectives that we have, the learning objectives for this talk, is one, to understand 4 alternative scenarios that engage us in thinking about the uncertainty in health and healthcare for the next 20 years. 2 is to know how leaders can create a tension and sustain a tension between the futures that we expect or fear and those that we aspire to achieve through what we do. And 3, to determine the strategic value of 4 recommendations for actions that you can take organizationally and as a nation to bend towards the futures that we want rather than those that we expect. So these are the structures of the scenarios. Let's look at the first one. It's slow reform, better health. So we can see okay, we got the Affordable Care Act. We're starting now on the exchanges. Some states not going along, some doing it. And we'll see over the next years there's going to be a lot of differences between states. In some, they'll really get the exchanges working. Insurance will be a better value. In many others, they're going to rely on just free market forces. And there will be a lot more insured, but a lot more underinsured. And so catastrophic coverage, but you're still going to see the bankruptcies as healthcare costs go up. And in fact, throughout the 2010s in this scenario, with the boomers retiring, the increased morbidity associated with lifestyle, the high technology increases that we can foresee, healthcare costs are going to keep going up through the decade, and we're going to get to 20% of GDP in 2020. So that's going to trigger a second round of healthcare reform. And in this scenario, a lot of that moves to, first of all, we're having a new infrastructure. So all the electronic medical records infrastructure is actually informating our environment so much. And we're starting to see the transcendence of the information revolution with something new emerging called the knowledge revolution. Any of you not have enough information? Imagine now we have the technologies that put that into context for better learning and for better decision making. There's going to be an opportunity in the 2020s to really align our resources and our value proposition in healthcare with what produces the most health. And this will probably happen especially at the community level. And it turns out that as we look at prevention, the studies and all this information converted to knowledge will tell us prevention makes a huge difference over the life course. And communities that get healthier thrive more. And so health actually is an input to wealth. And so we're going to see a lot of reform moving, and it turns out that social health is one of the keys to population health that we're going to start turning, social disparities and determinants of health. Let's go on and look at scenario 2, health if you can get it. So think about what went wrong over the last 5 years. You know that terrible, the Great Recession? The next one will be worse. We're going to be seeing now our governance. You think about all the lack of capacity, the passionate, I'm right, you're wrong in our politics. It gets worse. And we oscillate between the people who say the government can solve it and the people who say free markets can solve it. And we go back and forth, ultimately not going anywhere. We call the healthcare in this scenario yo-yo healthcare. Yo-yo, you're on your own. If you're poor, you try not to even show that you're sick because your boss will blame you and you may lose your job. Oh, you can get insurance, but it's not worth much. Mostly you're going to try to cobble your care together. You go to the walk-in clinics. If your community has community health centers that the doctors haven't so constrained and lobbied against, that maybe you get in line to get your care there. If you're wealthy, you go to the concierge care and you can get better care than you can get today. There's a lot of new innovations coming. You can get very personalized using biomarkers to predict and prevent. We've got some new treatments for Alzheimer's, targeted for cancer, but many can't afford them. And so in this scenario, we finally reach a point in 2028 where there's a revolt against the great gap, because every time we went into a recession, the poor got it worse, and when we started to climb out, the wealthy captured most of the benefits of the economic growth. So in 2028, we go to a single-payer system. However, in scenario 3, we actually see remarkable successes. So scenario 3 is big data and big health gains. So it turns out while Washington and the media was paying all the attention to the disagreements, that underneath, in community after community, there were leaders doing great things, bringing health to communities, making a very big difference in improving health care, and realigning value. So cities like Detroit hadn't had a grocery store in how long, and it was a food desert, and now we're seeing over 1,000 community gardens, and we're seeing people actually learning to eat better. And as those successes get more publicized, the media shifts from the dominant media to the social media. And so it starts to move across the country, and networks of leaders bring about surprising change and realign value. Now, the science here is terrific. So in this knowledge revolution, each of you will have your individual data cloud, zettabytes of information coming from biomonitors, some that are implanted, some that are worn, some that are around the environment. And they're paying attention to what's happening with you at the cellular, at the molecular, at the tissue and organ level, and they're getting signals way before you become symptomatic that your health is at risk. And we'll have models and simulations that can predict that. And so we get a major shift towards health, technologically supported, but also culturally moving to align health and healthcare. Now, in the 4th scenario, this becomes a true community movement that emphasizes the spiritual dimension of health. So yes, as in scenario 3, we're addressing the social health. We're taking on the disparities, recognizing that these diminish the potential. Anybody born into poverty loses the health potential, loses the wealth creation potential, and that's not good for community health. We pay a lot of attention to health metrics in all our communities here. And it turns out that one of the great effects of giving everyone health care insurance is they felt cared for. But as we become smarter about this, we understand that our spiritual health, the spiritual health of a wealthy person, is expressed by their caring for the poorer people. And those who have the love, joy, and faith and awe, that they actually give to their community health gains that are reflected in communities that become more vibrant, that they become much more capable in the new economy. Now, as in scenario 3, the new economy is much more local. You buy local, and yeah, it's not just like it was in the early part of the century where you buy your local vegetables and maybe some of the crafts. No, we have 3D manufacturing here, so that we're actually able to bring back very smart manufacturing at the local level. So community economics becomes a very important way in which our whole nation starts to thrive again and flourish. And we recognize that locally, we can't afford to expend on health care where it doesn't contribute to health. And in fact, if we expend on health care that takes away from health, that's a mis-expenditure, and we'll start to really regulate that locally. So that's scenario 4. So we asked those who gathered in Kansas City to say, now, given these different scenarios, what are things we should do now that no matter what the scenario, they're sort of future independent. Just do these, and these will be good for moving us towards a future we prefer. One is to act to develop new health roles right now. New career ladders, community lay workers, community systems workers who can work across our systems, our transportation, our public health, our education, the new healthcare to health integrators to help bring those movements around communities. So a whole new set of health roles. And remember, these are not your conventional health care delivery. These are people who are figuring out how to deliver and improve health, community by community. A second is to focus the the information technology and knowledge technology industries on community health metrics. Now, if we give them the incentives, they can really figure out how we can measure, monitor, and work on creating well-being in communities so that we move healthcare dollars to health. And we assure that what we're doing at communities is making sense to get us the greatest value in terms of health return of any investment in healthcare. Third is we need new leadership. And we need leadership devoted to health. This is leadership at the national level, at the state, and at the community level. It's leadership in every profession. And this is leadership we've learned that works informally through networks. So they may know how to work as leaders in organizations, with the formal and the positions and the power structures. They also need to know how to work informally through networks to bring about change much more rapidly. So there are new kinds of leadership as we're entering a new era where social networks are much more powerful oftentimes than organizations. Throughout our government and through industry, when I talk to them, they talk about the stovepipes or cylinders of excellence. The network leaders, the new leaders we need, realize how to move people with aspirations to challenge the status quo and to bring about change far more rapidly than we have within organizational contexts. And finally, these are removing the barriers to health and human flourishing. We have to revive the American dream. At our founding in the Declaration of Independence, it was declared each of us had the right for the pursuit of happiness. If you have no health, you have no happiness. We've created a barrier to happiness and health for huge populations in our society. We have to remove those barriers. I want to conclude that as leaders, you can create a tension between the futures that people expect or they fear and those they aspire towards, that they'd like to work to help achieve. And now is a great time for leaders. There's so much uncertainty in healthcare that if you can take a vision to people and you can share a vision so they can see communities flourishing in the healthiest nation on earth and then use that vision to compel action, then you have the opportunity that is greater in the next decade than it's been in my whole lifetime. And I think this is what leaders will be doing across the country for the next 20 years. And I hope you'll join them and make it so. Thank you.